On behalf of the Kiwanis Club of Hopewell and the Hopewell JCs, it's such a pleasure to be here and to be working with this team again every year. I'm sure that the team from Caribbean Health Outreach, as Mrs. Cassidy said, is going to look after you very well, even more than you expect, I'll tell you, because they do think of everything before they come down to Jamaica.
Orlando Pyle, the Medical Director for Caribbean Health Outreach, and I'd like to welcome each and every one of you here from Lancers Bay. This is our first time here. We appreciate Pastor Clark for inviting us and for helping taking care of the community. I've been a medical director here about 10 years, and I've been coming for 15 years. However, diabetes is a major problem here. And so with diabetes being a major problem, and many people do not have glucose monitors to check to see what their blood sugar is. Their blood sugar sometimes are extremely elevated. And even though they go to a doctor and they'll get medication, but they supplement their diet with high sugar fruits. So like mango, Nesberry, and so these fruits are high in sugar content. It's okay for them to eat it, but they may be eating that too much and the blood sugar gets too high, and the medications they're receiving does not allow the blood sugar to come down. Many of the patients don't want to take insulin. So the fact they don't want to take insulin, so the doctors are giving them pills, but eventually sometimes these pills are not adequate to control it. So complications of diabetes, having retinal problems, blurred vision, affects the coronary arteries, the brain vessels, affects the kidneys, and affects circulation to the legs. So you'll get blindness, you'll get renal failure, you'll get strokes, heart attacks, you'll get numbness and infections of the feet, and gangrene and amputations. One of the balances to that is a lot of people here walk. So activity is very good for cardiovascular activity. However, eating salted foods counteracts that. So we have to give them some diet education in terms of restricting salt and still being able to enjoy their food and enjoy what they eat, and then take their medications. We've had several patients come here today. They didn't take their blood pressure pills and their blood pressure is high. So they said, well, I rushed out too early and I didn't eat or whatever it is. So we're looking at the results of that.
The number of patients that we see every week is in the high hundreds. Sometimes we see up to 1,000. But on an average, the type of services that we provide, and we provide a wide range of service. You would be amazed to know some of the things that we do. PAPS, women's health, is one of our biggest focus. We also do a medical symposium where the persons in the medical profession can get credit for their continuing education. We also do dental work. We also do an athletic program, because we discovered that a lot of our young athletes having cardiac problems and dying on the fields. So we introduced that. So we have a team that work with high school to deal with their soccer team. As a matter of fact, we just did Russia's soccer team, and they're the defending champion for the Costa Cup. And we take care of the entire cost where that is concerned.
The medication is donated by some of the pharmaceutical companies in the United States. The ophthalmics are strictly donated by the ophthalmics. Other medications are purchased by the Caribbean Health Outreach by fundraisers that they have during the years. I'd say about $15,000 to $20,000 in medications every year, at least as U.S. value.
The motivation for giving back to Jamaica actually is a passion of my wife, and she's the founding member of the organization. And she made a commitment to herself that once she was in a position to give back, that she would be doing that willingly. And so I share her views as well. I really want to give back to my country, and that's what really motivates us. The single most important factor, though, is the fact that we concentrate all our efforts in deep rural communities, because we know the difficulties that the elder people have in trying to reach the pharmacies or trying to get medical care. So we choose that not by accident but by design, and we'll continue to do that for as long as we are providing service.
We at Hanover Charities have been supporting this health fair since its inception, 15 years now. We are their major sponsor, and we're very proud to assist the CHO, Caribbean Health Organization, and the Kiwanis and the Hopewell JCI. This is exactly the kind of partnership we're looking for at Hanover Charities. And we thank all the volunteers who come out every year to make this such a great success. We are proud to be a main sponsor.